Everyone, welcome to my live session. How are you doing today? Welcome. My name is Adeola Adeyemi. I'm a mental health expert, a psychiatrist, a psychotherapist, and a mental fitness coach. I'm the founder of Talk Mental Health. I welcome you to this live session today. Thank you, Okwe, for joining. So today's topic is actually very interesting. But before we dive into today's topic, I need you to tell me your name and where you're joining from. No volume. Oh my goodness. Can you hear me now? Please let me know if you can hear me. I just need to be sure you can hear me. If you can hear me, please let me know. Can any other person confirm if you can hear me? If not, I could come off the live and go back again. You can't hear me? Please confirm if you can hear me. Let me know if you can hear me. So I'm sure it's not from Okwe's side. Oh, Okwe can't hear me. Hi everyone. Thank you for joining my live. Ariduno, thank you for joining my live. I can see Ronke. Please let me know if you can hear me. Can anybody hear me? So Okwe can't hear me. Oh, Aridunu can hear me. So thank you, Aridunu, for confirming that. Yes. So maybe Okwe, you need to go out and come back again, okay? Maybe there's some poor connection from your end. Thank you for confirming. So I need you to, it's not your phone, Okwe, it might just be poor connection. So come off and then come in again, all right? Thank you, everyone. Please let me know your name and where you're joining from. I'm super excited about today's live. It's Mental Health Awareness Month. And if you know me very well, you understand what I do, what I stand for. I'm a psychiatrist. I treat people with mental health disorders like depression, anxiety disorders, schizophrenia, all types of mental health disorders. And as a mental fitness coach, I train people, I teach people, I educate people about their mental health. Maybe I should say that again. As a mental fitness coach, I train, teach, educate about mental health. So mental health is not only limited to mental illnesses. It's not just about disorders. It's about wellness. It's about well-being. It's about staying mentally healthy. Okay, go and buy a new phone. iPhone 14. Go and buy iPhone 14. So yes, back to what I'm saying. So that's one of the things I do, and I'm very, very passionate about what I do in terms of teaching people to be intentional about their mental health, creating an awareness about mental and emotional well-being, letting people understand that it's okay to speak up, it's okay to ask for help, it's okay to come and say, I'm not feeling well, I'm not okay today, I'm feeling depressed, I'm sad. This is something I love to do because, yeah, thank God, Okwe can finally hear me. This is something I love to do because I believe our mental health has to be top-notch before we can achieve other aspects of our lives. Before we can become successful, rather, in other aspects of our lives. Let me say that again. Our mental health has to be top-notch for us to achieve success in all other areas of our lives. Just come to think of it. If you're struggling mentally, if you're not okay, if you're finding it difficult to cope, and you want to concentrate, you can't concentrate, you can't deliver all what your boss has asked you to do, you can't meet the schedule, you can't meet up with the deadline. Thank you, Okwe. You can't meet up with the deadline. Definitely, it's going to affect your productivity, how you deliver what has been given to you. It's going to affect your confidence. So when you keep getting negative feedback from your boss, from your supervisor, your manager, then you're going to feel less confident in yourself. So believe me when I say that your mental health has to be top notch for you to achieve success. And that's why I love what I do. If you are not following at talkmental.health, you're wrong. So if you're on this live or you're watching the replay, I need you to go right now and make sure you follow at talkmental.health. And also, turn on your post notifications so you don't miss out on the amazing content we always share on our platforms. Okay, so this is introduction part. We're almost getting to 10 minutes to the beginning of this live session. I need you to introduce yourselves. So I know Okpe is here. I know Aridono is here. I know some people I've just joined. I don't know you all, but I want to meet you. So could you please tell me your name and where you're joining from? I can see Mary. I know Mary is from Cyprus. I know Okpe that joined earlier is Canada, or he lives in Canada. He's from Nigeria, but he lives in Canada. So Aridono is in Nigeria. Please let me just know where you're joining from. I just love to connect with people that are on my live. It helps the connection. It helps the interaction, because today's session is going to be interactive. So I need you to tell me your name so I can actually call you out and say, oh, you say this or say that. All right, I'm waiting. I'm waiting. Hi, I'm Otosho. Where are you joining from? Nice to meet you. So I'm waiting. We have 1 more minute to introduce ourselves. Today's session is going to be powerful. It's Mental Health Awareness Month. We need to get comfortable with discussing our mental health issue. Omotosho from Birmingham. Nice to meet you, Omotosho. Aridono is from Nigeria and is in Nigeria. So yes, I know. Welcome, Aridono. So I just want us to get comfortable with talking about mental, just the way we say, oh, I'm having a headache. I want you to walk up to people and say, yes, I'm feeling depressed. I'm sad today. I'm not in the mood. I mean, get comfortable with saying, so I'm having thoughts of killing myself. Like, say it. Oh, you came from Nigeria. Nice to meet you. I say, let's get comfortable with this. And that's why we need to break that culture. We need to talk about suffering in silence. All right, so yes, I'm going to dive into today's topic. So I've been wondering, why do people find it difficult to talk about their mental health struggles? Does anyone know what the reason could be, or what you think, even yourself? Maybe you've been through a time in your life where you were struggling with your mental health. What came to your mind? What was the first thing that came to your mind to say, oh, I don't think I can say this? Like, it was difficult to say that I'm going through something that has to do with my mental health. Why? So why? I'm waiting. Why do you think people struggle to speak about their mental health? Hi, Joyce. Hi, Uzo. Nice to meet you. Why do people struggle? Why do people struggle to speak about their mental health problems? By the way, mental health is defined according to the World Health Organization as the state of well-being in which an individual is able to understand his potential, cope with normal stress of life, work fruitfully and productively, and contribute meaningfully to a society. So every one of us has got mental health. Every one of us has got mental health that has to do with, related to the mental or social well-being or emotional well-being. Yeah, every one of us, we've got mental health, and as such, we need to be protective of our mental health. That's what it means. No one shouldn't be. I believe all people that are following me should be on this live, like, because our mental health is important and we need to do all we can to protect it. So when I hear mental health, most people would think it's all about mental illnesses. No, there's a difference between mental health and mental illness. All right. So I've got some answers here. So my question was, why do people struggle to share their mental health struggles, even with friends? Just like you say, I have a headache, or I have menstrual dysmenorrhea, that's menstrual cramps or something like that. I have stomach ache. Oh, yesterday I was down because I was too lean. I had diarrhea. We just say all of that. But when it's related to mental health, we don't want to share with no one. So yes, I have some answers. I'm going to say, what will people say about this behind my back? So I would say like shame, right? I'm not sure. If you agree with me, it sounds like shame. Maybe you're shameful. You don't want to be seen with, as someone that's got mental health struggles. But it sounds like shame. What will people say behind my back? So fear of stigmatization. So Okwe said fear of stigmatization. Exactly. That's another reason. So these are two things people have mentioned. What will people say behind my back because of the shame? What are the kind of things they can say behind your back? I'm not so sure if you could expatiate. What are the kind of things they can say behind your back that you think would make you not want to say, you don't want to hear, you feel bad about when you've discussed your mental health struggles with people? Shame, yeah. So what are the things? Because I've heard some terminologies, some names, name calling of people that have got mental health struggle, like, oh, the person is weak. Are you the only one? Oh, you maybe you're mad. I remember when I was growing up, and as a child, what we were told, or the picture we got of people that have got mental health problems, people that are roaming around the streets wearing tattered clothes, perhaps people that are dangerous, that are very aggressive. Nobody wants to associate with them. They're isolated, they're neglected, they're not people that you want to talk to. So the disgrace, the shame, the name calling, Yaba left, you see? Yaba left. Favor, I said Yaba left. Oh, she's suffering of this. Imagine. So those, the name calling, the demeaning words, all of these are associated with shame. Nobody wants to feel like down, like a downcast. So because I've got a mental health problem now, so that's the end of my life. It's like a death sentence. That's how it sounds sometimes, especially when you share it with others. So people would rather feel comfortable to say I've got physical illnesses, yeah, or I've got malaria, typhoid fever, even chronic conditions like hypertension, diabetes. They will even say, oh, but you're still young. Go, why are you having this? Why are you having diabetes? Why are you having that? But you can still talk about it, even when it's chronic in nature. But when it comes to mental health problems, nobody wants to say it because you're afraid you're going to lose friends. Omotasho has said, oh, can we still relate or associate with her? Why? The name calling, people with mental health disorders are regarded as dangerous. Like, this person is dangerous. Just normal human reaction. If you get angry, just because you have been diagnosed with bipolar affective disorder. So, by the way, bipolar affective disorder is a mood disorder whereby the person has different mood reactions. So there are times where the person feels depressed, low in mood, not interested in doing things. And other times the person is elated. So there's no stability in mood. So the person feels excited. There's impulsive buying. The person feels on top of the world. Other times, so just one person showing those varying type of emotions is what we call bipolar affective disorder. And sometimes in extreme cases, the person can become very irritable. But with the use of medications, mood stabilizers and all of that, the person feels better. The person is okay and the person is able to function. So say, for instance, the person has got the diagnosis of bipolar affective disorder. And the person is fine, you're walking, you're doing well. Just because you react. If the person should react to something that a person without mental health disorder would probably do the same thing, just because of that, in quotes, label of mental health disorder called bipolar affective disorder, the person would be saying, oh, today, sorry, I spoke Yoruba, meaning that she has come again, or he has come again. The illness has started again. This is a normal human reaction. This is something that anyone could have done. But because of the mental illness and the perception that people with mental illness are dangerous or aggressive, then you judge the person, that stereotype. You judge the person by that without being objective or keeping all those things within context. So these are reasons, one of the reasons why people struggle, why people find it difficult to talk about their mental health struggles. So for those of us that have just joined, you're welcome. We're talking about suffering in silence. It's Mental Health Awareness Month. And I've just asked some questions about why do people struggle No, that's not the question. Why do people find it difficult to talk about their mental health struggles? So if you have any contribution, feel free to drop. If you have any question, please ask your questions. That's it. One of the reasons that I've seen, that I've known over the years, that I've in my years of practice, right from Nigeria up to where I am in the UK, the same. It's so consistent. It's everywhere. It's just that it's commoner in developing countries, like Nigeria, than developed countries in the UK where I am now. So the first thing that makes it difficult for people to speak about their mental health struggle is stigma. Stigma, and I think Okwe mentioned it, stigma. The shame culture. What will people say? Why? It can't be me. I've heard of people who lost their job because they have mental health struggles. So sad. I've heard of people who lost their relationship. They could not. In fact, I know that when those days when we wanted to get married, they would ask, do they have mental health disorder in their family? Our parents would ask. You can imagine. Stigma. Because once you have mental illness, you or even in your family, nobody wants to associate with you. It's more like a death sentence. But it shouldn't be. It shouldn't be, because I mean, you can as well just ask all the list of disorders, like disorders of the head. You get what I mean? Disorders of the head, disorders of the heart, disorders of the kidney. And ask for all the disorders of every organ in the body. And then you say, because of that, if anyone takes it, or any member of the family has hypertension, diabetes, you don't want to marry into that family. But it doesn't make sense. As we age, we tend to, go through some health challenges. And thankfully, there are medications we could use or lifestyle changes that we need to do that will help us deal with this physical health conditions. But why should we have to now say mental illness is separate? Why? Because as long as you have a brain and you have a mind and you think, then you are likely to have, you are liable to coming down with mental health problems. Please don't say God forbid. It's just what I'm going to be saying, sharing with you facts. What WHO has said, 1 in 4 persons, 1 out of 4 people, that's 25% of people, will come down with mental health disorders, in their life. My connection is poor. Can you hear me? Please let me know if you can hear me. It says my connection was poor and then it went off. Please let me know if you can hear me. If you're still here, let me know. Let me know if you can hear me. What's happening to my connection today? It's so poor. Hi. I need to confirm if you can hear me. Let me know if you can hear me. It says my connection is poor, but I just need to confirm if you can hear me. Thank you, Okwe. Thank you. So as I was saying, if we have a brain that we use to think, then why can't we come down with illness associated with the brain? Why should we be ashamed to speak about the illness that is associated with a part of our body, our brain? Why should we now, segregate mental illness from other kind of diseases? Because of the shame, because of the stigma, because of what we think what it is. But I'm here to let you know that no, mental illness is not what we think it is. As a matter of fact, people that have mental illnesses are not considered dangerous. In fact, it's only a minute percentage of them that is said to be dangerous. The general population is even said to be more dangerous than those with mental health disorders. I'm sharing facts with you guys. So that, you say people with mental illness are dangerous. Because of that, I have to be careful. I don't want to talk to them. No. It is not different from what any other person without mental illness would do. As a matter of fact, a lot of people are not diagnosed. They've got mental health symptoms, but they are yet to be diagnosed. A lot of people are just walking on the streets of Lagos. A lot of people are here, even in the UK, that have got mental health struggles, but they have not been diagnosed. Do you agree with me? If I start, I just don't have the time to start breaking it down for you. If I list some symptoms, I'm sure some of you will tick those boxes like, oh, Dr. Adiola, you're talking about me. You're talking about me, because that's it. And that's why I'm here to educate you, to let you know that talking about mental health is not the end of life. It's okay. In fact, it's better to say that you are struggling and get the help early rather than leave it and let it linger for a very long time. The prognosis gets worse the longer you stay or wait to get treatment. The prognosis gets worse. So why are we ashamed? Why? And that's, if you're on this live or you're watching the replay, I need you to start changing your orientation regarding mental health. You need to start understanding that we all have got mental health, and that you have no diagnosis of a mental illness like depression does not mean that your mental health is top notch. So that you have not yet been diagnosed with depression or anxiety does not mean that your mental health is good. So it's a continuum from, just imagine an imaginary line from 0 to 100. Mental health, people with mental health disorders are on 0 level, and someone that's got a very good mental health is on the 100, part of the line, and you can fall on any part of that imaginary line at any time, and at any time in your life. You can be on 30, you can be on 50, tomorrow you can be on 70, another time you can move to 30, even without a mental health disorder. Do you get what I mean? So my point here is to let you know that because you have not been diagnosed does not mean that, oh, thank God, my life is better than the person that has depression. Who says? It's only a matter of time. No one is immune to mental illness. Just give it a time, or God forbid, a stressful life event can break you down if you're not careful. That's why I need us to start showing kindness, showing empathy to people struggling, not calling them lazy, because that's the names we call people that are struggling to meet deadlines or are unable to do some things. You think they're lazy. No, it could be a symptom of depression. I've been there, so I know what it feels like. You lose interest. You don't want to do anything. You don't feel like talking. You're hurting, but you don't even know how to express yourself. You don't know who would understand you. That can be very painful, and that's why it's even more difficult. When we're treating mental illness, it makes it even more difficult, because it's a thing to say what you're going through. It's another thing for some person you're speaking to understand. Are you getting me? Are you feeling what I'm saying? I mean, there's nothing as painful as giving out everything, saying everything, and the person that you're speaking to is pressing phone. You want to die. Like, you will feel you will feel worse, and it hurts. Because if it's a physical illness, if I have headache, let's say it's headache, or you fainted, for instance, or your BP rises, or you are vomiting, people will rush, they will rally around you, rush you to the hospital. But when you sit down to say, oh, I'm feeling sad, this is how I'm feeling, I can't concentrate, I've not been sleeping well, I don't feel confident in they won't want to listen, and we need to change. This has to stop, because our insensitivity to others is one of the reasons why people don't want to talk. Am I right or am I right? If I'm making sense, please let me know. If this is making sense, if I'm hitting the nail on the head, let me just know. Tell me. Because if I come to you and tell you that I'm feeling sad, the other day I put up a reel about mommy, I'm depressed, I feel sad. Give me a reply as an African mother. You see all the comments. If you've not seen the reel, I don't know if you saw the reel. You see all the comment people, because that is our reality. If I come to you and tell you I'm depressed, they'll tell you, what's wrong with you? What happened? You know? Sometimes I don't want you to give me an answer. I just want you to listen. Like, listen to me. That's how people with mental illness feel sometimes. They want to be heard. They want to be understood. They want someone that will listen to them. But because we're always in a haste, we're not paying attention. We have divided attention. We're pressing our phones. So that's it. Exactly. So Mojo said, just because poor mental health doesn't need blood transmission, it's like nothing. Exactly. It's sad. So because if it's physical health problem and they say you have anemia now, oh, you need blood, everybody will be running helter-skelter to save your life. Oh, do you know what it feels like to feel like ending your life? You know, some people will even laugh and make joke out of it to say, what's wrong with you? You this small girl. What are you thinking about? Really? Just because you don't need blood to, just like you would have done if you were to be, okay, like anemia and all. But mental illness kills faster than physical health problems sometimes. Because every 40 seconds, one person dies by suicide. So I've been on this live for almost 30 minutes. Please do the math. How many people are already dead within this 30 minutes of live session? Every 40 seconds, one person dies by suicide. So we need to start changing our ways. It all begins with us. Every one of us. Because our orientation has to change. We have to start seeing mental illness, mental health differently. Like, from our perception. You start from yourself. Like, become more self-aware. Be ready to speak. Look out for people that will listen to you. At Talk Mental Health, we offer free counseling session. Come register. Book your session. We do that at Talk Mental Health. Book your sessions. Our counselors are trained, are highly qualified. They will speak to you. They will listen to you. Speak to people that would listen to you. Don't suffer in silence. Say your mind. All right? You start from there. So start from you. Also, be your brother's keeper. Someone that you know, a colleague at work, your sibling, they're going through something. Speak to them. Let them know they can lean on you. I'm not saying take too much on yourself and neglect yourself. What I'm saying in essence is that be there for people. Be there for people. If you can't even help, signpost them to other sources of help. Signpost them. Let them know that, oh, okay, can you speak to Talk Mental Health? Oh, I've been to Talk Mental Health, a live session. She said, they offer free counseling. Let me go to their website. Go to our website, www.talkmentalhealth.org. Come to our DM. Just connect with people that would listen to you. Not just friends. Yeah. Mojo say people just want to be heard without judgment. Yeah. And at Talk Mental Health, we are very, very objective, but very professional. No judgment. We create safe space. Because sometimes a lot of people that would go for counseling or therapy session, and the therapist will be the one telling you, oh, you shouldn't be doing that. You cannot. The way you continue this way, you will miss heaven. They'll start preaching. I've heard of people go through such therapies. You feel worse than you've been. Before you came for the therapy. Amen. That's no matter who the person is, no matter what they've said, even if it doesn't make sense to you, you still don't have to make them feel less of themselves. Validate people's feelings, even if it doesn't make sense. Validate people's feelings, even if it doesn't make sense. So it starts with you. It starts with people. It starts with you understanding what you feel and speaking up. Hi, Rajiv. It starts with you understanding and speaking up when you're not feeling well, looking for the right people to speak to. That's one. Number two, you also being that right person to others, listening to people, making them feel understood when they are suffering, not condemning them. Not condemning them or telling them that, or what they're saying, or minimizing, how do I put it, or making it seem as if what they are feeling is invalid. You need to validate their feelings, no matter how silly it may sound to you, or maybe like, oh, there's nothing wrong with it. I've been through worse. You are not meant to say that to someone that have just shared their own personal page. Are you in their shoes? Do you know what they've been through? Even if you've been through worse, that's not the right time to say it. You're just going to let people keep quiet. Sometimes I tell people, if you know you cannot help, can you just keep short? Rather than giving some nasty comments on the social media, can you just be quiet? I'd rather not say anything than say something that would worsen someone's feelings, that will make them feel worse than they already are. So you need to be kind, right? And also, one of the things that I know that usually affects people or prevent people from speaking up when they're struggling is lack of understanding. So some people think that because I have mental illness, that's the end of life for me. Oh, it's a death sentence. No, it is not. Most of the mental health disorders are treatable. Most of them, I would even say all of them. It's just that the outcome differ from person to person. All mental health disorders are treatable. We've got medications, we've got therapy, but because of the chronic nature of mental health disorder, recovery is what differs from person to person. So, for instance, if you've got depression, some people, once they have depression and they get treated almost immediately, let's say within 2 months of having the symptoms, some recover and they would never have that kind of symptom again. Others might have another relapse, what we call a relapse, meaning that after a while, if there's a significant life event or any kind of stress, they get triggered again and they'll come down with another episode of the illness. Others might not have it again. Some might have it and they just need to go through the medication and therapy again. You get what I mean? So it differs from person to person. And another thing is, if you have had mental health disorder before, like, you've been treated with mental health disorder before, how you live your life after really matters. You being proactive about your mental health. If you're on medication and your psychiatrist has said you need to continue to take your medication, then you have to continue the medication, except you have side effects. That can be looked into, reviewed and all. Therapy, the lifestyle you live, making sure you focus on positive things, exercise, which is very fantastic, meditation, journaling, prioritizing self-care. These are ways by which you can enhance your mental well-being if you've had mental health disorder before. So you're already proactive. You're not waiting till there's a breakdown. You're not waiting till there's another episode. You're already bridging the gap that, oh God, I cannot have this thing again. So I'm very, very careful. You're also aware of the triggers, anything that would trigger any mental health. So you already know. So you sleep well because you know that, if I don't sleep, if I stress myself too much, it was what led to depression the last time. I won't do that again. So you avoid it, you sleep, you enjoy your beauty sleep for 9 to 10 hours. You know what you are doing. So when people come to you and say, you are sleeping too much, you understand, because you know that you don't want to go back to how you used to be before. You are proactive. So that way, if you live your life that way, you are less likely to have another breakdown. Unlike people that will just continue to live life the way they used to, not being aware of their triggers and all that. And this applies to everybody. Whether you've got mental health disorder in the past or not, whether you have mental health disorder now or not, you have to be proactive about your mental health. Be intentional about your mental health. Be careful what you listen to, who you listen to, who you follow on the social media. Be mindful of how you react to stress, the kind of stress you put yourself through and how you manage stress. These are ways by which you can stand tall right? Stand tall and withstand any kind of life event, because life events can't be wished away. Stress is normal human experience. It will always happen. May God not let us have something that will be beyond what we can bear. He has promised us that he will not put more on us than we can bear, right? So we pray every day that God will not let that happen to us. But when it comes to normal everyday stress, you need to know how to manage this, right? You need to know how to manage this. So Mojo has said, Doctor, sometimes sleep doesn't come when the mind is troubled. Oh, yeah, Mojo, that is why you need to practice sleep hygiene. There's something we call sleep hygiene. There's some habits that you need to cultivate. Put your phone away. Make sure the room is conducive. These are things that you need to look into. So if you notice that you're not sleeping well consistently for a period, and it could happen sometimes that you don't sleep well, maybe 1 day or 2 days, and the following afterwards you're able to sleep, that's fine. But then for a week you've not been sleeping and you're trouble, you need to speak to someone. Speak to a therapist. Maybe something is going on before it gets to the point when it will now become too overwhelming for you, and that will lead to a mental breakdown. One of the reasons why, people who just continue to live their life and not pay attention to their symptoms, it makes it even more difficult to manage, because it would have piled up, it would have gotten worse, and then recovery becomes very, very difficult to achieve just because you allowed it to linger for too long. So if you're not sleeping well, if you're struggling with sleep, there might be a lot of reasons. It might just be that you need to change your environment. It might just be that you need to reduce the way because sometimes you're troubled. So why are you troubled? What's bothering your mind? You need to start finding out, why do I need to worry this much about it? Is this something I can control? If I can't control it, if it's something I can control, you leave it aside. You control, if something you can't control, you let it go. If it's something you can control, you manage it. You face it and you do the right thing. But if it's something you can't control, why bother yourself about it? So sometimes we need to, condition our mind to sleep. Condition your mind to sleep. It's very important. Get your phones off. Put your phones off close to bedtime. Put on music. Make sure the environment is conducive. And I've always told people, when it comes to sleep, if you have trouble with sleep, make sure you create time to think during the day. So whenever it's time to sleep, tell yourself it's time to sleep. I'm not going to bother myself anymore. It's quite important, right? Mojo has also said that's where clinical helps will be needed most, like antidepressant, right? Mojo, because you're not sleeping well does not necessarily mean you need antidepressants. So the reason why you're not sleeping well might not necessarily be because of depression. It might be due to some other things, and that's why you need to be assessed. So you see a doctor, a psychiatrist to be precise. You get assessed. So if there's need for you to be on medication, you'll be placed on medication that will help with the sleep. If not, you can continue to manage yourself, like the sleep hygiene I mentioned. These are ways, non-pharmacological ways we manage sleep problems. All right. So so that's it. So what was I saying? I've forgotten my train of thought. So it's quite important for us to be proactive about our mental health. I know a lot of us on this live, perhaps people that would watch the replay, must have experienced some form of mental health struggle or the other in the past. Am I right? I mean, when I say mental health struggle, I'm not saying mental health disorder. In fact, some people might have had mental health disorder. But when I say mental health struggle, struggling with coping with stress, struggling with relating with people, struggling with managing your emotions, these are mental health struggles. So if you've ever had mental health struggle, please comment and put a comment in the comment box. Let me know that I'm not alone. Have you ever had mental health struggle? All right. So T-Shop has said, what happens when there's nothing in particular bothering you, but you are just not happy? It happens a lot of times. So if you're just not happy and there's nothing in particular that is bothering you, it might just be, maybe that's sometimes some people have mood swings. Some people it's just their personality trait. They might have some mood swings sometimes. It might just be that you've exposed yourself to a lot of negative news. It does happen to me sometimes. I had to unfollow some social media platforms, some social media handles on Instagram, because the negative news kept affecting me. I would just find myself ruminating and thinking about what has happened to a child that died or something. So I don't like sad news. So I just had to separate myself from it. So you need to know what if you cannot find something that is bothering you in particular, perhaps you need to switch to something positive. So what are the ways by which you can improve your happiness level? So you can find what works for you. It might just be music, it might just be exercise, it might just be watching a movie, reading a book. Get yourself back into the good mood. Sometimes you may not find the reason, but then you can find ways by which you can get yourself back to the right mood. So if you don't know why you're feeling sad, that's fine. You don't have to know why all the time, but you can change your mood regardless. So switch to what works for you. Find something to help you lift your mood, and then keep, living your life happily. Okay? So yes, Seleya said yes. I suppose that's the question I asked about people having mental health struggles. Have you ever had mental health struggles before? I'm about rounding up. So if you have questions, please drop in the comment box. So when I say mental health struggles, I mean struggling with coping with stress, struggling with relating with people, struggling with sleep, worrying excessively. These are mental health struggles. I'm not saying mental health disorder, mental health struggles. I know every one of you must have had mental health struggles. Abba. There's no way you tell me if not. Have you ever cried before? Have you ever cried before as an adult? Have you ever cried before? Have you ever felt pain, hurt within your mind before? We all have. Except if you don't want to be truthful. We all have. And that's why we need to start getting familiar with this. This mental illness has come to stay. Mental health has come to stay. The earlier we embrace it and say, oh, this is it, this is our reality, just the way we did hypertension, diabetes, even malaria and typhoid, the better. The reason why people are not recovering from mental health is because it takes a while for us to accept, because of stigma, because of shame, because of lack of understanding, because we believe that because I have mental health, that's the end of my life. No. So we need to start changing the narrative, changing people's mindset. So I need you to go back to your workplace, go back to your home, start telling people that it's okay to speak about my mental health problems. Say it. I'm feeling depressed today. That's fine. Because if you had headache, you would have said, I'm having headache. It doesn't matter the number of times you have the headache. You will still say it. So why can't I keep telling you that I'm feeling sad? Even if I say it every day, that's fine. Because that's how I feel. So we need to start cultivating the habit of saying how we truly feel to people that will listen to us, that will be willing to listen to us, not people that would make you feel even worse. So you have to be mindful of the people you speak to. Be very mindful. You yourself need to change your attitude with regards to people speaking to you. Do you get what I mean? So as I round off, if you have questions, please put in the comment box. I want to round off so that I would answer your questions. As I round off, it's Mental Health Awareness Month. So I need you to go back and start thinking of what ways can I change my perspective to mental health? What habits would I take on going forward that would help me improve my mental health? What role would I play as a person to other people in my area that would help them improve their mental health? Don't forget the definition of mental health, according to World Health Organization, that says it's a state of well-being in which an individual is able to understand his potential, cope with normal stress, work fruitfully and productively, contribute meaningfully to his society. So if you're able to tick all these 4 criteria, then you are considered mentally stable. I understand that sometimes we struggle to understand our potential. We struggle to even cope with stress. Sometimes we can't even manage stress adaptively. We're always getting this outburst of anger, being irritable just because we are stressed. So anytime that happens to you, just know that according to World Health Organization, not me, you're considered not mentally stable, because you should be able to manage stress effectively. All right. So sometimes there will be times that you'll be low. Sometimes there will be times you'll be high. You'll be okay. And it's fine to have those imbalances in your mental health. It's just for you to understand what to do to get back right, or to get right back on track. Okay. So I needed to go back home. Go watch the replay again. If you're just joining, if you stayed with me till the end, go and watch. How do I improve my mental? Because my work is not, I'm not fulfilled when you, after this live session, you can't pick something that you learned from this live session. You can't say that, oh, this is what Dr. Adiola has said, and going forward, this is how I'm going to live my life. So that's what I need you to know as we celebrate Mental Health Awareness Month, as we create awareness about mental health. What can you do to improve your mental health, and how can you change your attitude to help others around you? Those are the two things I need you to work on. So go home, think about it, reflect. How do I improve my mental health? How do I help others around me? So that'll be all for today. I thank you everyone for joining my live session. It's okay to not to be okay. It's okay to be sad. It's okay to have mental health disorder. As a matter of fact, no one is immune to mental illness. We all can have mental health problem at any point in life. And it's okay to have it. It's okay to speak about it. Even for men, I didn't dive into that because I know it's a lot to talk about. Men, speak up. A lot of men are struggling in silence. If I go into that topic, if I go into men and mental health, I'm sure I won't finish this live session. And I know a lot of men need to hear. We need to start breaking. Which one is man up? Man up. I don't need you to be strong. It's okay to be vulnerable, men. It's okay to be vulnerable. So if you're a man watching this, or if you're a wife or a partner and you know your man is struggling, can you just let them watch this part of the replay? To say that it's okay. You know, a large percentage of men don't speak up about their mental health struggle because they don't want to be considered weak. See, it's a sign of strength when you say you're struggling. It doesn't make you less of human. It doesn't make you less of a man when you come out to say, I'm struggling, I've got mental health struggle. You know, I know that from statistics, we have more women coming down with depression. But in the real sense, it appears that men would not come to say they've got these mental health problems. They won't go to hospitals. You know, and by the time they get to hospitals, for those who go, it is when they started having psychotic symptoms. Right? They started having psychotic symptoms. The symptoms have gotten worse. That is when they present. They don't even present. They are taken by their lovers, by their family. They are taken to the hospital because of how their behavior has changed. Maybe they become aggressive. Maybe they're behaving abnormally or bizarrely. That's when they go to hospital. Whereas women, at that time that you're feeling low, you're not interested in doing things, you're having suicidal thoughts, that's when they go. They don't wait till it gets worse. So in my own opinion, I believe we have a lot of men that are depressed. They're covering, they're hiding behind their jobs, they're escaping into their jobs, they're acting, taking alcohol excessively just because they're depressed. But I want you to know, if you're a man watching this, that it's okay to speak about your mental health struggles. It doesn't make you less of a man when you do. Rather, it shows that you accept your humanity. You're human and you are okay. It's okay for you to be vulnerable. Okay? Just the way you willingly would go to a cardiologist to say that I think my blood pressure is high. I think I've been feeling dizzy. Maybe because you've not been using your medication, your high blood pressure medications and all. It's the same. You can go to a psychiatrist to say that you're struggling, you're feeling depressed. It's fine. I have more female come to me in my DM to say they have mental health struggle, they're feeling depressed, than male. I can count the number of males that have come to me since Talk Mental Health was founded in 2018. There are very few. Very few. Right? So Sasha has said this is so true regarding men. Let's try and help them, please. Let's help our men. So women, I know I have a lot of women following me. I have a lot of women join my live. Please, please, and please. I know you have a man in your life. It could be your dad. It could be your brother. It could be even be your husband or your partner. Please and please be mindful of how they behave. Encourage them to speak up when they're struggling. I know they will definitely say, shun you off and say, there's nothing wrong with me, I reject it in Jesus' name or something like that. But you know them better. You know how to go through to them, speak to them, encourage them to speak up. Men are struggling. We have more men suffering in silence than women. And that's why you would see more men with substance abuse disorder than women, because they bury their pain, their heart pain, the mental health struggles in substance use. So they abuse substances and all of that. I need us to encourage our men to speak up. Okay, I was about rounding up, but I just something just dropped on my mind to speak about men. Let's encourage our men to speak up. Okay, so that will be all for today. I know a lot of people just joined. A few people just joined. Please go and watch the replay. It was a fantastic. It's been an amazing session. You can see from people's feedback. It's been amazing. It's been fantastic. I could feel myself pouring out my heart to this. So I need you to go back and watch the replay. And don't forget the 2 things I asked you to do. Go back home and reflect on what you need to do to improve your own mental health. And secondly, how you can help others around you, including the men in your life. All right, so that will be all. Make sure you enjoy the rest of your evening, and don't forget to be intentional about your mental health. Bye, everyone.